Hi, quickly wanted to review this week's case study and maybe point out some things you didn't notice and confirm some things you did. So when we look at this study, we're going to start with the beginning. 35-year-old female comes into the office. So her chief complaint is nausea and vomiting. Okay. History of present illness, slight vomiting, nausea and vomiting for the past 3 weeks. Her weight is stable. And then, really you do want to ask about weight, because if you have weight gain, weight loss, weight gain, for instance, you have someone with just heart failure gaining weight, or you have weight loss, you worry about cancer, anorexia, other things like that. So weight is something you always want to look, check on each visit, and then, look back and see what the trend is. That's really important. She's concerned she's pregnant. She missed her period, but sometimes she does. She's been trying to get pregnant. And she's concerned about the baby and the husband. So I have the husband's age here, and you notice that I have 2 articles in your references dealing with paternal age, because a lot of people know about maternal age as far as Down syndrome and a bunch of other sorts of genetic disorders, but we forget that fathers their age does make a difference there as well, so make sure you read those articles. She hasn't been going to her primary care provider. So when you think about that, she's behind on her just regular health maintenance type things. She hasn't had any flu shots, and it's also been 10 years, so we got to think about like her tetanus. She should have had a tetanus shot in that amount of time, or vaccine in that amount of time. So you think about screening and tetanus shots she hasn't done. So she hasn't had a PAP, she hasn't had tetanus, she's only 35, so there's not a lot of other screenings that would be going on now, but she hasn't had those things. Her social history, no drug use and no drug allergies reported. This is a social history. I'm just trying to think of what this is here. Past. Oh, surgical history. I'm sorry. I was trying to figure out what that was. It's past surgical history. None of those reported. All right. So she's not been taking any over-the-counter medications, and we know she wants to become pregnant. So folic acid is something we definitely want to encourage women to do that are trying to become pregnant. Her cousin has some sort of congenital genetic condition. She can't have children, and her sister has a child with Down syndrome. So the thing, before you open the door, what are you thinking about? And this is super important, because this is going to lead how you're going to ask questions. So when I get a patient's chart, I always look over their chief complaint, and then usually there's some bit of history that my nurse has already gathered for me, and then I look through their past medical history and that sort of thing. So I kind of, even if I walk in the door and it says nausea and vomiting, okay, as the chief complaint, and her chief complaint here was nausea and vomiting. So you think about, like, what are common things to deal with nausea and vomiting? So, most common is just like gastroenteritis or that sort of stomach virus type thing. So that can cause nausea and vomiting. Then you also think about things like pregnancy. That definitely can cause nausea and vomiting. Then you have to think about, like, gallbladder disease can cause nausea and vomiting. So you kind of go through the list. So these are the kind of questions you're going to ask your history now, based on what's kind of going through your mind as to what's going on here with her. Okay, so there's a variety of things that people put down in this list, and as long as you can justify it, you're good with this. But I do want the why. Okay. So, if you were thinking, if you look through this and she's, missed her period, they're irregular, she could be pregnant. You're right, it could be just irregular periods. There, she could have something else more worrisome going on there. But, this list of questions, so a lot of this, the thing you should look at is nausea and vomiting. Should have gastroenteritis in here because that's the most common reason, right? And then you should have pregnancy up here. So if those two really need to be here. Then beyond that, we can have some other things. So don't get tunnel visioned because this is a genetic module. Don't think just genetics. Don't get tunnel visioned here, all right? Okay, if she's pregnant, what if any congenital disorders could be present, okay? And then, this also, should, definitely the number one thing should be Down syndrome. And then, hopefully you've read the article and you can look at some of the father's things here, but you can, pick up the top 4 things here. The big thing here is that the husband's sister having Down syndrome isn't going to affect this child. And that the cousin having some sort of genetic issue could or could not. We, at this point in the game, we really don't know what the cousin's condition is. So that's so vague. They may or may not be related. That's so vague. We really don't know enough information there to be able to say a whole lot. What genetic disorder is possible? So here we want to come up with what genetic disorders can cause infertility. Okay. So those should be the answers to that question there. And then you want to think of like a list of questions that you would ask that would help you here. For instance, your nausea and vomiting has been going on 3 weeks. Is it better, more before or after you eat? That sort of thing. So she said it's not related to food at all. She's just been kind of feeling nauseated. Do you feel, is there a time of day when you feel more nauseated? That sort of thing. Have you had any other symptoms? There's a whole list of questions you may or may not want to ask in here. But when you think about these questions, I want you to put the questions and then put why you're thinking about them, okay? So you'll learn in this class really, the questions are one thing or the answers are one thing, but why you put the answers to me are more important because I want to know the critical thinking process that went behind the answers, all right? And then, what advice would you give any woman about her diet? And this should be to use if you're taking in folic acid, but I want a reference here, okay, for that. All right, so then we go into, you learn a little bit more about her. You want to calculate BMI. So she's 5'8", she's pretty tall, right? She's a little on the thin side for that age. I didn't calculate the BMI here, so one of you guys have, I'm sure. And then when we look at her history, she's tall and thin. Now, I marked this in red because I wanted you to highlight this for you guys, okay? Other than that, this part looks normal. Her neck looks normal. She's got a little murmur. That's not normal, right? So when you go to the part in physical assessment, you'll learn that, and hopefully you already know that murmurs are either absent or graded 1 to 6. And you'll get that. So systolic murmur, diastolic murmurs, we worry about, those are always pathologic, but a systolic murmur can be a whole bunch of different things. Okay. And she does have an enlarged uterus. Okay, so a large uterus. So, number one reason for a large uterus in a woman this age who's having irregular periods, pregnancy, right? But there could be a tumor, a fibroid, or something like that too. So we have to think about those as well. I should have put this in red. She was able to hyperflex her fingers and elbows. So this should triggers something in you. Hyperflexing, tall and thin. There's a particular phenotype that goes with that. Okay, so that would be Marfan syndrome. You should be thinking about that. Then she has some light brown colored spots, and she is pregnant. Okay, her urine is a little concentrated. There's no glucose in it. She's got a little 1+ white cells in there. Okay, so this is more than likely a clean catch or a bag urine, so we're not really going to get too worried about that since we're negative nitrates and everything else like that. So just kind of know your source of your UAs. So if you're just passing over some skin, it could not have been cleaned well. Her hemoglobin is a little low. Okay, now let's go back to that murmur. Anemia can cause a murmur, especially in a pregnant woman. Okay, so just remember that. Also, it's not unusual for people with Marfan syndrome to have heart issues as well, because, you know, as Marfan's, as you know, is a connective tissue disorder, and they can have some heart issues as well with that. So just be aware of that. So when it says here, deleted chromosome, and then she's short, so she's short, she's female, she has a deleted chromosome, and she can't have a baby. So this should have narrowed it down to Turner syndrome, okay, for you. And then I talked about the mom's phenotype. So, you know, I'd be worried about Marfan's in her, all right? For genetic issues, we very well might want to think about doing some chorionic villus sampling on her, and then with the brown spots I'm getting at to the neurofibromatosis, which probably at this point should be expressed in her. She should have little neurofibro okay, so we already kind of talked about this one. And how concerned are you about the cousins affecting the child? No, we're not concerned about that at all. And then possible causes of the murmur, we already talked about this, all right? So hopefully that helps you kind of see what we're looking for in these different things. There is not necessarily one right answer. We don't have we have information. We don't have all the information, but we should be narrowing down the list of what we're thinking about, okay? So that's kind of where this is going. I hope this overview helps you with your future case studies, and I hope you did all right with this particular one. Thanks.